Hi guys, this is our final lecture for exam 3. We're going to talk about environmental emergencies. And depending on which environment in which you work as a nurse, you may encounter patients who have experienced some type of environmental emergency, especially in the ER or urgent care settings. Or you may just encounter environmental emergencies out when you're enjoying the seasons of Colorado and our beautiful state. Here are the objectives that we're going to cover. We're going to describe the etiology and patho-involved environmental emergencies. We're going to describe the collaboration, collaborative care provided to patients experiencing environmental emergencies. And we're also going to describe teaching the nurse can provide in regards to environmental emergencies. So starting with heat emergencies, now we already had Rebecca come speak to you on Monday about burns as a type of heat emergency. We are going to talk about some other types of heat emergencies now. Heat emergencies happen when the body's regulatory mechanisms to control body temperature can't keep up anymore when the body is exposed to extreme and intense heat. So initially the body will increase sweating, increase the respiratory rate, or vasodilate the blood vessels to compensate for this increase in body temperature. But once those compensatory mechanisms fail, the body will start to experience heat stress. And heat cramps, heat exhaustion, and heat stroke are all types of heat stress, progressing from less severe to the most severe and life-threatening, which is heat stroke. So let's talk about heat cramps first. Heat cramps are caused by intense or heavy work and could be exercise as well. The individual will start to get leg cramps or other symptoms such as nausea, tachycardia, and diaphoresis. All of these are leading to a dehydrated state. So this is people that are athletes or someone doing physically hard labor in the heat for long periods of time. To treat heat cramps, it's important to drink adequate fluids, and really Gatorade is a good one that has electrolyte replacements. You also want to encourage the individual to stop the strenuous activity and rest for at least 12 hours, if not more. Ibuprofen or Tylenol can be given as well to treat the cramps that might happen, along with elevating the extremity where the cramps are occurring. Heat exhaustion is our next one. This is where a person has been exposed to heat for a prolonged amount of time, for hours up to days. This is kind of a step up in progression from heat cramps. So you have to think about temperature and humidity as well. High temps and high humidity can make the problem worse. The individual will show signs and symptoms of dehydration again, and the body temperature will begin to increase more. The patient will still be diaphoretic and they might look ashen in appearance. They can become anxious and also become mildly confused. So the treatment for heat exhaustion is to remove the individual from the heat and to start to cool them down by removing clothing or placing cool towels on them. They will probably need to be cardiac monitored, and IV fluids of normal saline are started many times, given as a bolus infusion to these patients to correct the hypotension and the dehydration that's occurring. Your vulnerable populations are at increased risk and may need to be admitted to the hospital for a little bit of a time period to correct the fluid and electrolyte imbalances. Our biggest electrolyte we're worried about is sodium loss here. So heat stroke is our most serious form of heat stress. It is when you have failure of the body's cooling system. The body can no longer compensate and cool itself down. The temperature can increase up to extreme temperatures as high as 105.8 or even higher. This is a core temperature. At this point, the individual will lose the ability to sweat because the sweat glands stop working correctly. And there will be more significant mental status changes such as hallucinations, combativeness, incoordination. This is kind of indicating that the brain is affected now and starting to swell and can't handle those high temperatures. Eventually there will be circulatory collapse, and basically shock happens from that severe dehydration and loss of sodium. And we have to think about our vulnerable populations again, who are going to be our highest risk groups. Again, older people, we always talk about older people and those with cardiac issues, people with kidney issues, and chronic kidney disease are at a higher risk of more severe problems with heat stroke. So the treatments for heat stroke, we are going to do our ABCs first, focusing on supplementing the patient with 100% oxygen, and to help, that will help with the hypermetabolic state that is kind of happening in the body. And then we're going to do interventions to reduce the temperature. We want to reduce the core temp to at least 102. Possible interventions are to remove clothing, to place wet towels on the person, immersing them in a cool water bath can also be helpful, but we want to be careful to not cause this person to shiver. Why would we want to not have them shivering? That is because shivering actually is going to increase the core temperature by increasing the metabolism of the body. If they do begin to shiver, there are things you can do. There's Thorazine that can be given IV. There's many uses of Thorazine. We've learned about Thorazine as an antipsychotic, but it also is used to treat shivering. You do not want to give them Tylenol because there is not an actual infectious process happening in the body, so Tylenol is pretty much useless. Fluid and electrolyte replacement is done through the IV, normal saline boluses again. Rhabdo can happen in these patients due to the insult occurring to the body and can lead to kidney damage because of that rhabdo. DIC is also a possibility related to the trauma occurring to the body. Okay, now we're going to talk about cold emergencies. Cold-related emergencies can happen because of various factors, and wintertime is a common time for people to have an increased incidence of cold emergencies. And our populations especially prone are people who are homeless and those who may be intoxicated by alcohol or under the influence of other drugs. Those with peripheral vascular disease as well as diabetes mellitus, those are your people that you're concerned about with cold emergencies because of the poor circulation happening. Frostbite is considered a localized type of cold injury that causes tissue freezing and formation of ice crystals in the tissue and in the cells. Hypothermia is more of a systemic type of issue with a drop in the core temperature of the body. And we'll go into more details here. We'll start with frostbite. So again, we said that it is tissue freezing and formation of ice crystals. The body's natural response to cold is to vasoconstrict the periphery and shunt blood to the core to hang on to that heat as much as possible. The vasoconstriction that is happening causes further formation of the ice crystals, which then causes more damage to the tissues and cells. So swelling begins to happen because of that damage. Factors that can affect the degree of frostbite include how long the exposure to the cold temperature is for, the clothing that the person is wearing, is it wet or is it dry? How well are they acclimated to these temperatures, to the cold? And also if there's pre-existing conditions, again, the peripheral vascular disease is a definite factor as well. You also want to check these people for hypothermia because of the exposure to the cold. If they've been exposed long enough to cause frostbite, then they might be suffering from some hypothermia as well. Frostbite has different levels, so we'll talk about superficial frostbite. This includes the skin and subcutaneous tissues of the fingers, toes, ears, and the nose. The skin color will become pale and progress to blue, mottled looking. The skin can feel like a crunchy, crispy, frozen sensation. The person will complain of numbness and tingling and also burning to their skin. These areas of the skin are so delicate, you want to be really careful about massaging the area or putting any pressure on the area. This will cause further damage. Treatment is to remove the clothing and remove any restrictive jewelry, anything that might be in the way, and to immerse the area in a circulating warm water bath to keep that constant warm temperature going through the tissues. When the tissue is thawing, it will be painful. It will cause a stinging sensation for the patient. Blisters can happen quickly, and they might need to be debrided as well. The patient will also need analgesia. They might have pain depending on what degree or what areas are affected. And we also encourage tetanus shots as a prophylaxis because of the person having a wound in place. Deep frostbite is where you have almost like a 3rd or 4th degree full thickness burn. It's similar to that. So you have learned about burns. And this is where the muscle, bone, and tendon are involved. The skin will be white hard and it will start to turn necrotic. The patient will lose the ability for sensation, so they won't have that sense of touch. Blisters are present as well, and there can also be swelling that begins within a few hours of the injury. Treatment is immersion in the circulating warm water bath, and there's more aggressive pain control happening at this level because of the deep tissue damage. That rewarming process is very painful, the tingling and pain. Elevation can help with the swelling once rewarming has occurred, and then tetanus vaccination is many times needed again. Wound care is really important at this stage, and every attempt is made to save the affected area. I've personally taken care of a few patients with frostbite, and they've started to do some cutting-edge types of treatments for these patients. There's evidence that the use of IV tissue plasminogen activator, or TPA, can actually help with management of frostbite because it's causing better perfusion in those tissues. And it also has been shown to reduce the need for amputation in these patients. It can take up to about 3 months to determine if amputation is needed for deep frostbite injuries. And so they, at that point, will decide if it's necessary to remove that necrotic tissue. Okay, so hypothermia is our next topic. This is defined as having a body core temperature of less than 95 degrees Fahrenheit. This indicates that the body heat is lost faster than what the body is able to produce or retain. And so body heat is mostly lost through head, thorax, and lungs with breathing. Wet clothes, if wet clothes are present, there will be a 5 times faster rate of evaporation of heat. And if there is immersion happening, there's a 25 times more amount of heat loss happening. Exposure to frigid temperatures in combination with inadequate clothing or inexperience in an environment that is very cold can lead to hypothermia. And again, we're looking at vulnerable populations, and our elderly are one of those high-risk groups They are high risk because they have decreased body fats. They have decreased metabolism, decreased energy reserves. Their sensory perception can be off. And also, if you think about some of our elderly patients suffering from dementia or Alzheimer's, they do not understand what's happening in their body. They don't realize what they need to do, so they don't respond appropriately, and they are at risk for suffering from hypothermia as well. So hypothermia does mimic other disturbances, and so it can be misdiagnosed initially because you can have the ataxia, confusion, and withdrawal, and so there can be a little bit of a misdiagnosis. The body will begin to respond by vasoconstricting and shunting that blood to the core to preserve that heat as much as possible. And then shivering will begin to try and compensate and increase the amount of heat in the body. So the pathophys, a little more detail about hypothermia. The metabolic rate will decrease as the core temperature is dropping, and the heart will literally become irritated by the cold blood. This can lead to dysrhythmias, and the blood flow to the kidneys is also decreased. And so because of that, the GFR will decrease as well. The lack of water reabsorption will lead to increased hematocrit and will cause kind of this thickening of the blood. The cold also adds to that thickening. This places the patient at risk for clot formation, and the patient will also become more hypoxic, and anaerobic metabolism will take over. Because of that anaerobic metabolism, you have lactic acid buildup, and so the patient becomes acidotic. You might have heard about hypothermia protocol after cardiac arrest. This is where they actually purposely put somebody into a hypothermic state. They purposely drop the body's core temp after cardiac arrest to the moderate stage of hypothermia, which is between about 89.6 to 93.2 degrees Fahrenheit. And they do this so that they can reduce the amount of cell death that's occurring and to suppress the inflammatory process. So just kind of an FYI, you might hear about that in cardiac arrest treatment. So these are the stages of hypothermia. I don't expect you to memorize the temperatures. So just kind of keep in mind that there's 3 stages. The most severe stage is where your body temp has dropped below 89.6. So if you can just keep that temperature in mind, you'll be good to go. So in the mild hypothermia, they do begin to have shivering and some confusion may be present and lethargy. At this point, you might see some irrational behavior in the individual, such as feeling the need to remove their clothing, which can then exacerbate the problem even more. In moderate hypothermia, the body systems begin to slow down even more. So your blood pressure is dropping, the heart rate's dropping, the respiratory rate's dropping. Patient may become more rigid, and they do at some point stop shivering. There's a little difference. I think your 10th edition book says shivering disappears at about 89.6, and the 9th edition says about 86 degrees Fahrenheit. And then in severe hypothermia, this is where all the vital functions become almost undetectable. This is where you will have dysrhythmias even more. Pupils become fixed and dilated. They still at this stage will rewarm the patient, and that's why I have on here not dead until they are warm and dead, because they will still go through the intervention of rewarming the patient to bring the core temperature to at least 86 degrees Fahrenheit. And once they've kind of rewarmed the patient and determined that the vital functions are not really there, they will go ahead and pronounce the patient as dead. Okay, so what are our specific interventions for hypothermia? Our priorities for interventions are to assess our ABCs and then rewarm the patient. And we also want to treat the acidosis and dysrhythmias that are occurring. So there's lots of different ways that we rewarm patients. There's more, it depends on how severe the hypothermia is. So passive spontaneous rewarming is kind of a more, like it says, passive type of rewarming, where you are removing damp clothing, you're putting warm blankets on the individual. Active external rewarming is kind of a step up from that. You are putting those air-filled blankets on, or the bear huggers, if you've heard that term. Warm water immersion is also used for these patients. Active internal rewarming is a step up from that. That's where you are focused on rewarming the core. This is really used for those severe cases of hypothermia. And you get that heat to the core of the body with warmed IV fluids. They use the rapid infusers to push that IV fluid in even faster than a normal IV pump can. They might even use hemodialysis to warm up the blood and infuse it back into the individual. And also, it's important to closely be monitoring the core temperatures. And how do we monitor core temperature? We do rectal temperatures. The rewarming process will be discontinued once the body reaches a core temp of at least 89.6. Rewarming puts the patient at risk for what's called afterdrop, and this is where there's a further drop in temperature from the cold peripheral blood that returns to the heart. So to prevent that, we want to warm the core body up before the periphery. So we use those active internal rewarming techniques to try and prevent afterdrop from occurring. Okay, now we're going to talk about submersion injuries. So submersion injuries are basically when you have a hypoxic episode related to submersion in some kind of liquid, typically water. Happens mostly in children under the age of 5 years old, and boys and men 15 to 25 years of age are our highest risk groups, mostly victims of submersion injuries. Risk factors include the inability to swim, impairment through alcohol or drugs, and also child neglect can lead to submersion injuries. They can also result from hypothermia. So a person becomes hypothermic, and this leads into a submersion injury for them. Drowning is when you have a submersion with respiratory impairment or suffocation. So this is where the respiratory system is not able to function correctly. There's also near drowning that can occur. This is when the submersion happens, but the victim survives the drowning. So in a submersion injury where the victim survives, they might aspirate on the water that they're in, and there's kind of two different types. I mean, it can be freshwater or saltwater types, and your book kind of goes into the differences between those two. They cause different types of fluid shifts based on if it's freshwater or saltwater. Not that you need to focus in on that, but ultimately they both lead to pulmonary edema in the patients and then can lead into what's called acute respiratory distress syndrome, ARDS, which we'll talk about more with our respiratory unit. So interventions for drowning and submersion injuries begin with the trauma assessment. And you all have learned about trauma from Mark now, the A through I assessments. Our big ones, ABCs, of course, we're going to possibly need an artificial airway for this patient and mechanical ventilation to help with the breathing, with the oxygenation. You're also going to look for other injuries to the body. Many times there's other injuries present to the neck or the cervical spine. So we want to look for that. That could have happened along with the submersion. And then you're going to treat the fluid and electrolyte imbalances that are occurring with the shifting of fluid in the lungs, and also can cause, you might have cerebral edema that is occurring with that. So our big drugs that we give for that swelling, edema, and fluid shifting is mannitol and furosemide to help pull off that fluid. And then we're also going to closely monitor these patients for further complications after the submersion injury or drowning. Okay, we're going to talk lastly now about how to handle environmental emergencies caused by stings and bites from animals and insects. The Hymenoptera family consists of insects that sting, such as bees, wasps, yellow jackets, and fire ants. And then ticks are found in specific parts of the United States. We'll talk about ticks. They're found specifically in northwestern and northeastern areas of the U.S. and also in the Rocky Mountains. And then we'll also talk about animal bites that happen from cats and dogs, as well as human bites and how to treat those. So the Hymenoptera family of insects cause stinging injuries. So a stinging injury can cause a range of signs and symptoms. There's a venom that's released. So you can see stings that cause redness and some discomfort in some people, all the way up to anaphylaxis in other people. Mild manifestations can be swelling, burning, itching, and pain. But more severe manifestations is where you have that wheezing, bronchospasming, and hypotension. So they're in an anaphylactic shock situation. There's a lot of variability of when symptoms begin, and it can be an immediate or delayed response over a few days. If there are multiple stings, the symptoms are typically more severe. And once a sting happens, you want to work to remove the stinger with a scraping motion, either with a fingernail or with a needle. You don't want to use tweezers because the tweezers can actually cause more venom to be released into the skin. The treatment depends on the severity of the reaction. First, you want to remove any watches or rings that might be in the vicinity, or anything that can cause a restriction from the swelling. So mild symptoms can be treated by placing a cool compress on the site, by elevating the area, and also by applying some kind of anti-itch cream with antihistamine, or a PO antihistamine can also be helpful. More severe cases will need to be treated with IV antihistamines or possibly IV epinephrine if there's more of an anaphylactic shock reaction occurring. And steroids might be used as well to calm that inflammatory process that's happening in the body. Tick bites. Ticks can be quite a nuisance for us if you're camping or hiking in the Rocky Mountains. And I know I've been hearing about ticks appearing in other areas as well. And for our pets, they can be a nuisance. They can cause severe diseases if they're not removed quickly. Lyme disease, Rocky Mountain spotted fever, and tick paralysis are conditions that are associated with tick bites. As long as the head of the tick is buried in the skin, there is a neurotoxin that is being released, and also that's when disease can be spread from the tick to the human or the pet. So to properly remove a tick, it's important to use forceps or tweezers to get a good handle on the tick and pull the body of the tick up and out of the skin kind of in one gentle motion. You want to remove that head. If it gets broken off, you have to go and try and get back in there and remove the head. Using heat or any kind of petroleum jelly or nail polish to try and suffocate the tick doesn't really work effectively because the tick is still salivating and it can still spread disease through that salivation. So we don't want to do those methods. Your best bet is to use tweezers and really get in there and remove the tick. Lyme disease is the most common disease from a tick. It can cause symptoms within days after a tick bite happens. It's specifically caused by a spirochete, Borrelia burgdorferi, that lives on the tick itself. So this is where that tick is spreading a disease from the spirochete. The signs and symptoms will include a bullseye type of rash initially, and then the person will start to have flu-like symptoms within a 3 to 30 day time period. They'll have general malaise, headache, and stiff neck. Treatment is done with antibiotics. They will use doxycycline initially to treat, and if the individual starts to have more severe symptoms down the road, such as monoarticular arthritis, meningitis, and neuropathies, they will use ceftriaxone to treat those. Lyme disease is one that can last months to even years and can cause a lot of disability. So it's one that you have to really be careful to monitor for and treat as quickly as possible. All right, Rocky Mountain spotted fever is caused by a bacterium. It's Rickettsia rickettsii. This bacterium is specifically found on the Ioxidid tick. What makes this tick bite different is that it causes this pink macular rash to the palms of the hands, the wrists, soles of the feet, and ankles. And it happens within about a 10-day period. Similarly to Lyme disease, the manifestations include flu-like symptoms. And early treatment is really important. If treatment is not done, this can lead to death. And they use doxycycline again as an antibiotic to treat Rocky Mountain spotted fever. And finally, with ticks, we can have tick paralysis. And tick paralysis is caused by the release of a neurotoxin of the dog or the wood tick. About 5 to 7 days after exposure to that tick, causes ascending paralysis over a couple days, and it will continue to cause paralysis if the tick is not removed. Death can occur from this if, again, if the tick is not removed. That paralysis can start to impact the respiratory muscles, causing respiratory distress, and therefore can cause death. The tick removal will remove that, or will reverse the paralysis quickly within about 48 to 72 hours. So that's kind of your main treatment of tick paralysis. All right, and on to animal bites. This is our final topic of our lecture here. The biggest issue with animal bites is that they cause infection and mechanical destruction of the tissues, can cause a lot of damage. Depends on the size of the animal and the location of the bite on what kind of symptoms are seen. Also depends on the victim and the victim's size. Cat and dog bites are the most common types of bites, and the infectious organism is Pasteurella species that the cats and dogs carry in their mouths. Dog bites occur more commonly on extremities, but can commonly occur on the face of kids. And the kids that end up having bites on their faces have to be specifically evaluated by a plastic surgeon for those because they can be so severe. Cats, when they bite, they cause deep puncture wounds, and therefore there's a higher likelihood of infection because of that. Humans have very dirty mouths, ha ha ha, and they carry a high risk of infection as well. Specifically from the oral flora that we have in our mouths. We have Staph aureus, strep, and hepatitis. So common bite locations for humans are the fingers, hands, that can result in what's called a boxer's fracture, where you have a fracture of the fourth and fifth metacarpals. Other areas are the nose, the ears, the penis, and the vagina, and those can be many times from assault occurring. So to treat bites, we really want to focus on cleaning the wound well, irrigating the wound, and debriding the wound if necessary. A tetanus shot is given many times, and then antibiotics are started for animal and human bites, especially if they're located in areas over joints. If the wound's between about 6 and 12 hours old, if they're a puncture wound, and bites on extremities of hands and feet are also important to start antibiotics for. For puncture wounds, it's important to leave them open instead of suturing them up. This will allow for any kind of swelling effect happening. Facial wounds are a little different. They are treated immediately with tight sutures, and again, the plastic surgeon is really important for a consult on any facial lacerations. And bites really need to be reported to the animal control or to police. I know sometimes we're hesitant to do that. Many times it's our own dogs that are biting, so that can be hard for people to do. Rabies vaccines are also done as a prophylactic post-exposure measure after a bite. So many times people will need to have a rabies vaccine given. And this is all the information for this lecture. Hopefully you find this information applicable regardless of where you work as a nurse. It's useful information because you just never know when you will encounter an environmental emergency. So hopefully you will remember these things.